now. So if you are ready, shall we start discussing? So we are looking at PSM FMG January 2026 recall. Okay, so let us start. We have in our session Dr. Ivermectin never ending also is there. Okay, friends, this was one question which we were having. Which statistical test is most appropriate for comparing cholesterol levels within a single group? So just go back to what we had discussed in the mission classes or even in the marathon rapid division classes also. When you are comparing cholesterol level in a single group, then that means we are taking two values before, after. Before, after means which test we are going to apply. Please confirm if the choices were correct. Yes, it is paired student t-test. Friends, I have prepared all these questions in last 1 hour only. So anywhere you find PSM was not there, ज्यादा नहीं था. 30 questions are there with me, तो 30 तो discuss कर लेते हैं, Dr. Yuhan. So paired student t-test before after. Please don't worry about the things which were not there. Check out of these 30 whether you managed to attempt 25 correctly or not, because majority of students are saying they were able to attempt 25 out of these correctly. So let's look at this. So this is within a single group. Okay. Any number of people may be there comparing cholesterol level in 300 patients, you are saying. If it was two different groups, then it will be unpaired. So you have to confirm me whether it was comparing cholesterol level in a single group or two different groups. If it is two different groups, then answer will become unpaired student t-test. Okay, it was before and after. So let us go by the original. Students have confirmed it is paired student t-test if it was a single. I'll come to everything, Dr. Sakurao. I have this question of Pearl index calculation also, right? Okay. Number of patients don't make a difference if it is a single group before, after. Parametric, normal distribution, quantitative data we have discussed. Paired student t-test. Same question has been asked earlier in your exam as mean systolic blood pressure before, after an intervention, right? Yes, Dr. Ritika Shukla is absolutely right. Question. Okay, look at this question. Rural program has increased number of vaccination, increased hospital delivery, increased access to healthcare. But when you compare it with urban areas, it was really less. Which of the following pillars, which of the following pillars of primary healthcare is most likely to be exploited? Exploited. Can you answer this question? What you have marked in the exam, friends? We are looking at rural area doing very good. But when we compare with urban areas, it is still very less. This is a type of which exploitation for which pillar of primary healthcare, friends? See, let us quickly do. Equitable, whether services are same throughout the geography of the country. Community participation, anyone from the community is participating like Asha worker. Appropriate technology, cheaper technology results like expensive technology, ORS breastfeeding. Intersectoral coordination, different sectors are coordinating or not. So answer was fairly easy, direct, equitable distribution. Still, urban areas are providing better basket of services as compared to rural areas, right? Okay. So equitable distribution. Intersectoral coordination, why it cannot be the answer? If you have, if you have different sectors coordinating with each other. A 2 years old child presented to primary health center OPD with bluish white spot in front of molar tooth. He has a history of cough and fever. What is the most likely diagnosis? Okay, students are saying here it was tribal program. Even then, answer will remain same. When two places, they are not similar to each other in terms of service delivery, the principle which is getting violated is equitable distribution. The services should be equally distributed across geography, across socioeconomic status also. So look at this question, friends. 2-year-old child, bluish white spot. So we are looking at coplic spot opposite second molar tooth. Second was not mentioned. Students were telling me he has a history of cough and fever. Cough, fever, and even that is not required. Once they mention, once they mention coplic spot, I think 100% of you must have marked this answer correct. Yes, it is not on tooth. When they say in front of, this they are talking of buccal mucosa only. So you ask the child to open the oral cavity if you can see in front of molar tooth, second, on the buccal mucosa. Can you please confirm the other choices? Can you confirm the other choices, friends? Even if molar tooth is not mentioned, only buccal mucosa is mentioned. Even then, bluish white spot, cough fever, we are talking of measles. Okay, choices were fine. Mumps, rubella, measles, and chickenpox, as the students have reported. Okay, tooth was not given. I have excluded from the language. Please help me correct the questions. Help me correct the choices also. But I am sure this question, 100% of you must have marked correctly. Okay, can we move forward to the next question, friends, immediately? Okay. Yes, questions may be a bit lengthy because students, when they tell us in a single sentence. So whatever information we could get, by tomorrow, I will get almost all language. Cough and red eyes. Yes, that is correct. Congestion of eyes is characteristic. Also, retroauricular origin of rash. If they mentioned the rash started behind the ear pinna, that is also very confirmatory of measles, right? Okay. Look at this question. Anemic woman, second trimester of pregnancy. They mentioned receiving iron folic acid under Anemia Mukt Bharat. What should be added to regimen to improve the efficacy of therapy? If you look at this, they are saying efficacy of therapy, older FMG question repeated again. Vitamin C helps in improvement of absorption of iron in the diet. Only 10% only facilitator. Everything else is a inhibitor. Then there was a question. Patient of Northeast India, fever and chills, peripheral blood smear shows Plasmodium falciparum. So when they're saying Northeast, some students mentioned state Meghalaya was mentioned. So any state of Northeast or Northeast was mentioned. And we are looking at Plasmodium falciparum. We cannot give ACT-SP. We will have to give artemether lumefantrine with primaquine, right? Primaquine. So artemether lumefantrine primaquine. I'm sure dosages must not have been asked because in your exam, generally for anti-malarial drugs, they usually go for the name of the drug. Okay, Manipur was mentioned, not Meghalaya. Okay. So any northeastern state, answer remains same. Answer remains same. Right, great. Okay, adding sodium to butter is fortification. Dr. Abhishek, I was not having that question. If you are adding sodium to butter, but you'll have to give me other choices. You only gave me fortification, that looks right. Was this the pond image they were asking? Pond image, a similar or this pond image was asked. If they're showing you like this, look carefully. This is a type of step well. They must have shown a better image. Students were not able to describe the image correctly. So if they are showing a step well in which people can climb down, then we are looking at Guinea worm. We are looking at Guinea worm. Guinea worm. Vitamin A2 butter is food fortification, Dr. Priya. If you are saying it was not sodium, vitamin A, that is food fortification. So vitamin A and D is added to dalda oil also, butter also, that is fortification of food. This is Guinea worm. People walk, then it can enter cyclops body. People are consuming. See, when people consume infected water containing cyclops which are infected, reaches, a person walks through the step well, water comes contact, skin of the leg ruptures, and suddenly the cycle is completed. Doesn't matter if there were pots near the step well also. Pots near the step well also, right? Okay. So this is Guinea. Okay, this was an image given. Rule of halves every time it comes in your paper. If you remember in one of your GTs also we kept a similar question. What was mentioned was that prevalence of the disease was not 50%. I think it was 30%. Is it if the prevalence of the disease was 30% who are having hypertension, then out of them, 15% will develop symptoms, half of them. Out of them, 7.5% will seek treatment, and it is half of that, 3.75%, who will get adequate treatment. So if prevalence was 30, half 15, half 7.5, half 3.75. So it was purely a mathematical calculation, right? Okay. No image was there. See, even if image is not there, we know there are four things. Total population, 50% have hypertension. Half of them get symptoms. Half of them seek treatment. Half of them get adequate treatment. So within the total population, there are four circles inside. This we have to remember, right? Okay. No, this is, I'm sure that this question was there. This has been confirmed by many students that 30% prevalence, and they asked how many get adequate treatment. Adequate treatment. Right? Okay. Yes, this is true for developing country also, developed country also. 3.75% will get adequate treatment. Innermost circle. Innermost circle. Even if it was not so simple, they will have to mention that 15% get symptoms, 7.5% seek treatment, and 3.75% get adequate treatment. Any one of these three will become the correct answer, will get the correct answer. Okay, there was a question. Which of the graphs should be used to depict the following data? Again, these numbers have been told by students. Numbers may be a bit changed, but look at this. Salt intake, blood pressure. You can see as the salt intake is increasing or decreasing, we want to see whether blood pressure is increasing or decreasing. So this is which diagram I should use. Which diagram I should use. 3.75 with two different options, then 3.75 will be the innermost, adequately treated. Okay, friends, this question, can you confirm? We are looking at salt intake, blood pressure. So we are trying to establish relationship between two quantitative variables. So I'm sure all of you must have marked scatter diagram as the answer. Correlation, yes, relationship between two quantitative variables. So this is fine. Okay, let us move forward. This has been confirmed. Values may be a bit different. 4.1, 3.2, 5.1, because it's not easy for students to remember all these 10 values after the exam correctly. Yes, even if salt intake is in ascending order, that would have been a better way to represent. Blood pressure increasing or decreasing with that relationship is established by. So what I will do, based on your recommendation, I will put this number here, right? Okay, thanks. Then there is a question first to confirm which image of Aayushman Bharat was there. Aayushman Arogya Mandir, which image was there? Was it number one? Was it number two or something else? But students told me that image of Aayushman Arogya Mandir was there. But they were not able to share the exact question. Exact question. Can you tell me what was the question? Question something was what students have told me. Identify the image, mark which of the following change has been there in the National Rural Health Mission. Okay, second image was there. Okay, so I will remove this image. Okay, so let us look at this image. Can you tell me the question? What was asked exactly? What was the question asked? Because students were not able to tell me the question. No name or image was there. No image was there. Image of Aayushman Arogya Mandir was there. They asked the other name. Other name is Health and Wellness Center, as we have discussed in the classes also. Last time also in your exam, there was a question on Aayushman Arogya Mandir does not provide services related to laundry. Other health, diagnosis, treatment related services, essential drugs, everything is available at Aayushman Arogya Mandir. right? Okay. Yes, this is a sub-center health and wellness center. So one of them has to be. Yes, okay. If they ask its new name, the new name of this is now Ayushman Arogya Mandir. So please confirm, new name of health and wellness center is Ayushman Arogya Mandir, right? Okay. Okay, Ayushman Arogya Mandir was in the option. Okay, that is good. In fact, that makes the question even more easy for us. So I hope all of you have marked this answer correct. Even if name was hidden, was the name written on the image in Hindi or English that Ayushman Arogya Mandir it is? Was this name written, this one, in the image? New name is Ayushman Arogya Mandir. Earlier it was Health and Wellness Center, Sub Center under Ayushman Bharat program, came to be known as Health and Wellness Center. That came to be known as Ayushman Arogya Mandir. No name was there on the photograph. Okay. No name was there on the photograph. Okay. So Ayushman Arogya Mandir. Okay. TPN bag is thrown into which biomedical waste management bag? I think this was also a fairly direct question. TPN bag means we are looking at plastic, which is a contaminated recyclable waste. Can you tell me plastic red colored bag, contaminated recyclable waste? Which bag should be used? Yes, it will go into red bag, right? Okay. We move further. There was a question on expired medication. Can you please confirm if this question was there? Because I was surprised to see so many questions from biomedical waste management, but we have discussed in detail. Was there a question on expired medication? Okay, you are saying here TPN bag photo was also there. Okay, that I will add. It's then it becomes even more easy. Plastic photograph, plastic bag. You have seen TPN bag in your hospitals also. Ayushman Bharat program, Ayushman Arogya Mandir is the answer. Okay, incinerator was in the option. If bag is not asked, then yellow bag is subjected to incineration. So you have to confirm, was the bag asked? Was the method of disposal asked? Okay, one option was black. TPN with attached tube. Okay, that I think one student told me also. Attached tubes, that I will add. Expired medication treatment is not through autoclave. Autoclave was in one of the choices. Okay. So it is, yes. So yellow incineration, you just have to confirm. Was the bag asked or the process or both were asked? Bag, process, both. Bag was not asked. Okay, good. So it is incineration. Yellow bag, expired, discarded medicines, incineration should be done. Deep burial was an option. Okay. Deep burial we have discussed in the class is only for placenta after delivery at a primary health center. That was also an old question. Right? Okay. So we go with disposal. Good. Everyone is confirmed. Then there was a question on calculation of Pearl index. Number of accidental pregnancies, total months of exposure into 1200. So you can see 4 upon 3000 into 1200. What is the answer we have marked? Please confirm the choices also. Answer will be 1.6 because other choices students were not able to share. Could you please share the other choices? This will come 1.6 per 100 women years. Okay, thank you, Dr. Vikas. I'll take a screenshot of your question. Thank you. Okay, one choice was 0.8. Okay, this is the answer, irrespective of the choices. One choice was 2. Okay. Answer is 1.6. So I'm sure all of you have calculated this correctly because Pearl Index, we discussed so many questions on calculation of Pearl Index. This is always automatically per 100 women years. Per 100 women years. It automatically comes. Right? Okay. 16 was not there, 4 was not there, 8 was not there. Right? Okay, great. Can you confirm there was a question on doctor-patient sitting arrangement? There was a question on doctor-patient sitting arrangement. Could you please confirm? There was a question on. Don't worry, Dr. Pranay, by tomorrow it will become 30 questions. Don't worry. Was there a question on doctor-patient sitting arrangement with highest risk of transmission of respiratory infection? Yes. No. Even this question was not there. But students was saying maybe image was also there. Dr. UAKX is saying, no, this question was not there. Okay, it was there. Majority of you are saying. So I hope all of you appeared in the same exam. See, if this sort of image was there, you have to see here. This is the window where they are showing movement of air. You can see based on the quality of the image that was provided. Yes, door to window ventilation is shown. Logically, you can see here doctor is out of the line of that ventilation. So this was a purely a logical question that this is a better. This is a better one. So what was the question? Can you tell me? Were they labeled as A and B? Did they ask which is better? Did they ask which is better? This will be better. This will have low risk. This will have higher risk. Because doctor is in line of the ventilation, better will have low risk. Doctor should always be away from the line of ventilation. Okay, better one was asked. Better one is this one, friends. Better one is this one, friends, right? Okay. Okay, there was a question on ICDS program of India. Please confirm that calorie and protein supplementation to a child 6 to 72 months was asked. Please confirm. ICDS program, calorie and protein supplementation to a child 6 to 72 months. Airborne infection, respiratory infections are same. Dr. Musab Nazar, even instead of respiratory, they wrote airborne infection, both are same. Both are same. Okay, this question was there. So in ICDS program, it is 500 calories. This is the answer for a child. 600 is for reproductive age group females. This is for malnourished child as per ICDS guideline. Malnourished child. Depending on the choices may be a bit different. This is the answer. In a child, we give up till 6 years of age, 500 kilocalories and 12 to 50. Okay. In some choices, we are being told 200, 300 kilocalories were given, 6 to 8 grams protein. No, this is not correct. This was the older guidelines. Now we are giving, since last 11 years now, 500 kilocalories and 12 to 14, right? Okay. Please confirm if there was a question on this immunization session. There are two ANMs, 2 hours time. They have to complete a total of 40 vaccinations. They have one vaccine carrier. What will you do to avoid wastage of vaccine or medicine and do session effectively? Do session effectively. Mark the best strategy. Okay, we go back to previous question. Students are saying ICDS was not there, school was there. See friends, this you have to confirm because question was attempted by you. If it is school, it will become midday meal program. If it is ICDS, answer remains same. Answer remains same. Okay, so we look at this. We come to this. Immunization session, 2 ANMs, 2 hours time. 2 hours time 40 vaccination. So you can see 120 minutes for 40 vaccination. They will get 3 minutes per vaccination. When a lot of children has come to the center, you cannot remove them from the list. No chance of immunization should be missed in the RCS program of India. Adding vaccine carrier will not speed up the process. Right? So what is logical? They divide the work. Documentation is equally important as vaccination. So let one of them work on the documentation, maintaining the records, one of them to work on the vaccination. Work on the vaccination. Okay, it was ICDS. Okay, majority of students mentioned ICDS. Okay, but one student is confirmed it is midday meal. Friends, you have to decide if it is ICDS, which majority of students say, then the answer is correct, right? Okay, let's move further. Please confirm a question came 100 patients telephoned, asked about if they exercise daily and have coronary artery disease now or ever before. Identify the study design. Identify the study design. If this question was there, then the answer is cross-sectional study. Both we are looking at the same time. Slight language difference may be there. Students were saying 100 patients were given, 200 patients were given. No, it's not about vaccine carrier in the previous question, carrying the carriers. It is about managing the session effectively, which was mentioned in the question. So you have to give vaccination, you have to do record maintenance at the same time. Let them do division of labor. This is known as division of labor. Okay. What were the choices? Cross-sectional was given in the choices. That becomes the answer. Friends, please confirm if cross-sectional study was given in the choices. Okay, cohort study, it was mentioned observational, you are saying. One question choice was experimental. Okay. Then answer is cross-sectional study. Cross-sectional study. Okay, let's move further then if it was. Then there was a direct question on screening is which level of prevention. Students were saying some specific screening was asked. If you remember that, could you please confirm? Because otherwise, screening is secondary level of prevention. Otherwise, it is secondary level of prevention. Screening is early detection of disease in apparently healthy by means of rapidly applied test. Okay, Dr. Rohit is saying it was midday meal only, not ICDS. Then it will change, friends. In midday meal, it is 450 kilocalories. You have to remember, and 12-gram protein in children below 5th class, and up to 8th, it is 700 kilocalories and 20 grams of protein, if it was there. Breast cancer screening. Okay, great. So any screening, majority of them, except maybe prospective, belongs to secondary level of prevention. Okay, 1,000 women screened in a hospital for breast cancer. Okay, that makes it question, right? Okay, besides screening, they are saying in the question, there was also a mention of, students are telling, treatment also. Both belong to secondary level of prevention. Okay, it was a camp. It was not in a hospital. They are saying it was in a camp. So that will also be screening of breast cancer is also secondary. Treatment of breast cancer is also secondary. So 100% of you must have marked this answer correct. Let's move further. There was a question on net reproduction rate, but students were getting confused in the language. See, direct language, if you see, number of girl children produced minus mortality. Otherwise, you can say how many girl children are replacing, how many newborn girl children are replacing one woman dying. Both are same correct answers. You have to tell me which was given. Which was given. Okay, mortality was not there. Was any such language given? And woman who is dying is replaced by how many newborn girl child? If such language was there, that is also net reproduction rate. Okay, replacement was not there. Friends, you will have to help me with the language of the question or the choices then. Dr. Utkarsh, Dr. Aarti, please help me with the language. Inertization, okay, that must be a separate question. We'll see separately. Okay, language no one remembers. Okay, number of daughters an infant baby produce in future. So number of daughters that a girl is going to produce in her future reproductive lifespan, and out of them how many remain alive, that is also net reproduction rate. Same thing is said in different language. Number of daughters produced by a newborn girl child in future reproductive lifespan. So what does it mean? See, it has different ways of saying same thing. If a girl child is born today, in her life, how many girl child she will produce minus the deaths? If a girl is or woman is dying today, she is replaced by how many living girl children? Okay. So answer has to be related to this. What I will do, friends, I'll try to improve the language with the number of help from this. Total number of girl children born in the reproductive age minus mortality per every girl child. Yes, that will become correct. Okay. Was there a question like this? Please, friends, confirm. Four things I was told were given in the boxes: evaluation, monitoring, planning, implementation. And we were asked to arrange them in sequence. Asked to arrange them in sequence. Evaluation, monitoring, planning, implementation. And we were asked to arrange them in sequence. Please have a look at this, friends. Evaluation, monitoring, planning, implementation. Okay, it was there. It was there. Okay. So can you now confirm whether these four words only were there? Evaluation, monitoring, planning, implementation. A student was, okay, delegation was also there. So implementation may not be there. It may be delegation. Is it right now? Okay, three you have to choose. How? Evaluation, planning, execution, and delegation. Okay. See, whenever you look at a planning cycle analysis of existing health situation, then you have to plan, then you have to execute, and logically evaluation will come in the end. Depending on what else was given, will lie in between. Planning cycle starts with planning, ends with monitoring and evaluation, if it was given. Delegation also will come in between if it was there in the choices. How you delegate the word for implementation or execution, right? Okay. Okay, what does broad planning contains? Question was broad planning. Okay. Okay, great. So if you are looking at three, then these are the three best options in sequence: planning, execution, evaluation. Planning, execution, evaluation. If you are asked about three out of them, right? Was there a question on why health for all has changed to Millennium Development Goal, Sustainable Development Goal? Health for all. Why it has changed to Millennium Development Goal, Sustainable Development Goal? Making a plan will also remain same, Dr. UAKX. It will remain same. Okay, plan formulation. Yes, first is to make a plan. Absolutely. Okay, there was a question on this also. See, health for all was for year 2000. Okay, can you help me with the choices because students are not able to tell me choices. So I presume if any of the choice was like this, measurable targets, that will become a better answer. Why? Because health for all was a very broad goal. Everyone should be healthy by 2000. Then we decided, let us make it more specific. MDG by 2015, SDG by 2030. Yes, they were not a health for all, was not able to reach their goal. So they broke down into targets easy to achieve. Yes, health for all initially was not time bound. Okay, this was one of the option you were seeing. Later, but it became time bound that we should achieve it by 2000. Targets on time. Okay, target question was there. So measurable was not there. It was for only communicable diseases. That is not correct. It included non-communicable diseases also. Only for low socioeconomic countries. No, that is not correct. That is also not correct, right? So it has to be related to measurable targets or to quantify whether you have achieved them or not. Question on pleomorphism in chickenpox, friends. Was there a question on pleomorphism in chickenpox? Please confirm. Was there a question on pleomorphism in chickenpox? Can you confirm? And what was the exact question? Okay, it was there. Okay, it has already been discussed by other faculty. Let's move further. Was there a question on treatment of lepra reaction in multi-drug therapy in the leprosy program? If it has not been discussed by others, then it has to be prednisolone. Okay, students are asking, there was a question on botulism. What was the question? Route of transmission. Canned food was there in the choice. Okay, then that will become the answer. If canned food was there, then for botulism, canned food, yes, becomes the correct answer. It is also through sometimes spores in dust. In the dust, spores are there, or it may also be through a wound. Also, if though there's botulism, Clostridium botulinum manage to infect a wound or enter the wound, then also it can occur. Okay, Dharma sir has taken. Okay, let's move further. Okay, friends, thank you. And now I'll hand over to the next faculty. I hope I came to know paper was slightly moderate to difficult today, but I also came to know many of these students have done amazingly well. Let's hope all of you clear the exam. I'm sure most of you are going to score above 170 to 180, and many of you are going to score 200 plus also. Yes, many questions may have been missed also. It always happen. Thank you so much. Now we have Dr. Ankur Jain sir here with us. Sir, please take over for biochemistry. Thank you.
Good evening, sir. Thank you, sir. Good evening, friends. So first question. Yes, a 4-month-old infant. You can tell me if any other modification. Please do comment. Hypotonia. Patient presented with hypotonia. Hypertrophic cardiomyopathy. Acid maltase deficiency. What is the... Thank you, dear. What's the diagnosis? Yes, we have discussed Pompe's disease previously. This is frequently asked question, recently asked question. Yes, pump, hypertrophic cardiomyopathy, and death usually occur due to heart failures. We all know. Yes. Thank you, dear. So, Pompe's disease, floppy infant, hypotonia, cardiac failure, hypertrophic cardiomyopathy, enzyme deficient, acid maltase. It is both glycogen storage disease and lysosomal storage disease. So mnemonic of two types. Type 2, yes, it is both lysosomal and glycogen storage disease. And in this, we pump with two hands. So you will remember hypertrophic cardiomyopathy and cardiac failure. So simple question, simple answer, repeat PYQ. Second question, a child present with self-mutilation, repeatedly bite fingers, yes, hyperuricemia, behavior issues, which of the following enzyme deficiency may be? So we have already discussed that HGPRT, Lesch-Nyhan syndrome, X-linked recessive eyelashes, yes, नयन X-linked होते हैं. So X-linked self-mutilation gout. Simple question, simple answer, repeat question. Hypoxanthine guanine phosphoribosyl transferase. Next question, long limbs, arachnodactyly, lens dislocation. This is Marfan syndrome. So they have given diagnosis Marfan syndrome and again repeat question fibrillin 1. Yes, fibrillin 1 mutation. Steroid hormone receptor bind to specific site of DNA by this question we have discussed. If you remember in DNA footprinting, I discussed that steroid hormone receptor just like a duck and he's having finger-like projection, yes, footprinting, and these are zinc finger motif. So these are steroid hormone receptors bind to specific site of DNA by zinc finger, yes, motif. Yes. So, zinc finger motif, this is taken from Harper steroid receptor family. Do have zinc finger motif. Other option, helix turn, helix motif, helix turn, helix motif, leucine zipper motif. Next time they may ask, although not asked previously, helix turn, helix motif, lac pressure. Yes. Mick genes have leucine zipper motif. Yes. Now, thank you, friends. It's your hard work, and definitely you will clear this exam. And biochemistry was really, really simple paper. I feel like this. Okay. Night blindness, retinitis pigmentosa. If you remember, I told you R for Refsum disease, R for retinitis pigmentosa. Yes. And other than that, phytanic acid is given. So simple question, simple answer. Yes. Yes. Two options. Yes, in this other options, even if given, no need to think, you will find the answer very easily. Okay. In this helix turn, helix motif, leucine zipper motif, examples I have given. Yes, this table from Harper. This question. Yes. Yes. This question. Yes, I want your support. If image is this crumpled tissue paper appearance, this hepatosplenomegaly may be present in Gaucher disease, Niemann-Pick disease. If this is crumpled tissue paper appearance, then answer is Gaucher disease. But few students told, sir, it was foamy appearance. Yes, bubbly appearance. Mnemonic was neem soap. If you take bath with neem soap, your bubbles would not be so clear as Nirma girl because you take bath after so long time. So that's why your bubbles are not so clear. Huh? So Niemann-Pick disease, bubbly appearance. Yes, gouge, ouch, ouch, bone pain. Yes, few students told that some detailed history was also given. Yes, bone pain was there, hepatosplenomegaly was there, crumpled tissue paper. Yes. Okay, what was the round bubble, bubbly? एक सोप बबल थी. ओके, तो इमेज एक बार सर्च करते हैं. इफ यू हैव एनी आइडिया अबाउट द इमेज, कुछ मिले तो बताना दोस्त. यस, ए नियोनेट प्रेजेंट विद लो सिट्रुलिन लेवल. सिट्रुलिन लेवल लो है. यस, अगेन इसमें तुम्हारा सपोर्ट चाहिएगा. Normal orotic acid level, high glutamine. What is the diagnosis? Hyperammonemia. Yes, in hyperammonemia, wherever ammonia is increased, it bind with alpha ketoglutarate to form glutamate. Again, bind with ammonia to form glutamine. In urea cycle defect, glutamine is increased. So this is not a problem for us. Yes. Yes. Okay. Glutamine. Okay. Orotic acid urea. Okay. I put. Yes, not orotic acid urea, organic. Even then, this is typical picture. Yes, type 1 hyperammonemia, you can solve all the description by this type 1 hyperammonemia. Let me tell you the answer first. Yes, if type 1 hyperammonemia, CPS1 is deficient, then ammonia will be increased, hyperammonemia. This carbamoyl phosphate will not be produced, citrulline will not be produced, orotic acid will not be produced. That's a hyperammonemia. Yes, low citrulline level, hyperammonemia, normal orotic acid level. Yes, maybe due to this pyrimidine synthesis. Now I will rule out other option, type 2 hyperammonemia. In type 2 hyperammonemia, there is orotic acid urea. Orotic acid urea. Okay. If hepatic encephalopathy is there, definitely these are symptoms, but even then you will prefer to mark type 1 hyperammonemia. Okay, because this is typical picture. Now, which of the following is defective in patient presenting with eruptive xanthoma with increased chylomicron? Yes, if chylomicrons are increased, eruptive xanthomas are there. Chylomicron increased eruptive xanthomas. Yes, eruptive xanthoma. Yes, this is eruptive xanthoma. Chylomicron increased. Then there is maybe defect in lipoprotein lipase or ApoC2. Lipoprotein lipase and ApoC2 or ApoC2 defect. Yes. ApoB100 defect. ApoB100 defect will lead to, even if ApoB100, there would be increased LDL, increased cholesterol, tendon xanthoma would be there. Yes. ApoE defect, type 3 hyperlipoproteinemia. This question is type 1 hyperlipoproteinemia. Type 1 hyperlipoproteinemia. Yes. So answer is lipoprotein lipase. One more question. Defect in conversion of uroporphyrinogen third to uroporphyrinogen, coproporphyrinogen third. Which enzyme is defective? Decarboxylase. Yes, if you remember, we discussed that porphyria cutaneous tarda, काटा तोड़ा, क्या काटा क्या तोड़ा, carbon dioxide काटा, carbon dioxide तोड़ा, it convert uroporphyrin third to uroporphyrin, coproporphyrin third, uro to copro. Okay. Yes, clear. So if you have any other question left, please do comment. I will include in the main recall. These few options are missing. We will complete in the main video. Thank you, best wishes, and definitely you will clear this exam. So now I hand over to Atul sir. Good evening, sir.
प्रणाम सर।
Pranam
प्रणाम।
sir, pranam.
कैसे हैं सर?
बढ़िया sir.
सब
Thank
मजा
you
आ गया सर
friends.
आपका स्टेशन देख करके।
Thank you sir. Thank you.
या ठीक है, थैंक यू सर। जस्ट अ सेकेंड, आई एम जस्ट शेयरिंग। I hope I am audible. And good evening, all students. So I can see Bhedia. So that means I am audible. So, but overall, as I understand, the paper was little bit moderate to tough, but forensic was doable. I understand the forensic was still doable, and most of them were from previously asked questions. I've been able to gather around 8 questions, and if you have more questions, please do let me know. So I think one of the question was that if a severely burnt body is found, then what kind of autopsy we will do. So please remember that dissection is done in almost all cases. Apart from that, you can do additional CT, MRI, etc. to help. So that is, and this is virtual autopsy. Okay. So virtual autopsy doesn't mean that dissection will not be done. Dissection is done. But apart from dissection, we also do virtual autopsy to see, and this is especially helpful if the body is severely burnt, because if the body is severely burnt, then it's very difficult to see the things. So there the CT scan is very helpful. So if someone is mentioning that fracture was also mentioned, so in a very severely burnt body, if you have to see the fracture, it's difficult by naked eye. In a severely burnt body, if the body is severely burnt, in a severely burnt body, if the fracture difficult by naked eye, okay, CT scan or radiology will be better. Radiology will be better. I don't know what other choices were there. This traditional photography is not autopsy, so this cannot be the answer. Virtual autopsy looks like the answer. So photography is not autopsy. Okay, नमस्कार जय गुरुदेव. So no more representatives. क्या बात है? So भेड़िया बन गए, तो हम भेड़िए के सरदार हो गए फिर. So virtual autopsy should be the answer, but I don't know if there is any other question or what are the other choices. If you can tell me from these two choices, the answer is definitely virtual autopsy. So any other choice, if you remember, you can tell me. Okay. Okay. Here, I think, please remember abrasion collar. This is a firearm entry wound. Abrasion collar are present in all the distances. All the distances. So this does not help. But please remember, if we have the choices like tight contact, close contact. What's the difference between these two? In tight contact and close contact, both of them, all three, singeing, blackening and tattooing are present. In tight contact, these are present only on margins. And close contact, they are present around the wound. Okay. But in intermediate range, there is only tattooing. And in distant range, nothing will be there. Neither singeing, nor blackening, nor tattooing. So as per this question, only tattooing was there. So answer becomes intermediate range. So this is also a previous year question, and this is also a previous year question only, previous year PYT, not Q but PYT. This is a PYT. So I hope everyone got it right, and this is a classical previous year question. Whenever the figure is like this, then it is voles, and I don't know if exactly this image was there. And so these all images I showed you in the class. This is loop, this is walls, and this is arches, and irregular mixture of all these is composite. Okay, so I hope this image was there. Holes image, it was loop. So that I can get to know only if I get the image. So it's very, I don't know what was there, but you just remember like this. This is walls, and the loops is like this. Loops is like this. Arches is like this. This is arches. This is arches. And this is loops. Okay. It was composite, sir, loop plus arch. I don't know because I don't have the image. Somebody gave me this image that it was walls, but if arch was, see, the chances that examiner will give composite is less. Chances that examiner will give composite is less. Composite is very rare kind of thing. So first image was there. This one, if this was there, then it will be loops. If this is there, then the answer will be loops. If this is there, then the answer will be walls. This is walls and this is loops. Okay. But anyhow, when I get more clarity, you can just let me know. And if it is there, then this is arches, not this image. Okay. But you got the whatever it was. So what was it? Maximum people just tell me what was it? It was arch. Okay, arch tha. So maximum people are saying it was arch. So we will understand, we'll assume that it was arch. Maximum people are saying it was arch. So arch is the answer. So this was not there. We will assume something like this was there. Okay. हाँ, तो I did not give the exam na bhai. So but I got the recall questions from भेड़ियास like you. ठीक है? तो arch is the answer. Maximum people are saying arches. तो तुम भेड़िए हो तो ठीक ही बोलोगे. Arches is the answer. We will go by that. Now, cross dressing. Cross dressing is transvestism, also called eonism. Okay. Now, it can be, if it is done for the purpose of sexual gratification, then it is called transvestic fetichism. Fetichism. But it can also be done for other reasons like some mental illness, gender identity disorder. But so ideal answer for this question is transvestic fetichism. But as I know, this choice was not given. So the second best answer is transvestism or eonism. So if in that case, eonism will become the answer. In case of fetichism, it is not cross-dressing. It is like footwear, undergarments, objects of objects of opposite sex. It is objects of opposite sex. But here the person is wearing the clothes of opposite sex. So we'll mark eonism as the answer. Chalo. And here the person can have sex with any woman but not with his own wife. So fetichism was there, but fetichism will not be the answer. Transvestic fetichism will be the answer. Transvestic fetichism was not there. No. Transvestic fetichism was not there. So the second best answer, we will have to mark eonism as the answer. Fetichism cannot be the answer. Fetichism means from the objects of opposite sex. And here the person can have sex with anyone but not with one particular woman. So this is quad hank. I don't know what the other choices, but this is a simple PYQ. So again, so this is also PYQ. This is also a PYQ only. So forensics were all PYQ, I will say, which I all teach in the class. Now here it's morphine, that is an opium CNS depressant. So here there will be all vitals are decreased, pupil size is decreased, and in vitals there is a decrease of blood pressure, heart rate, respiratory rate, and body temperature. But so from this, tachycardia cannot be the answer because the heart rate is decreased. Pupil size is decreased, so pupil dilated cannot be the answer. So people would have got confused between pupil constricted and bradypnea. क्वाड वाले दो ऑप्शंस थे सर. ठीक है, अभी उस पर दोबारा आएंगे. Let's first discuss this. So bradypnea and pupil constricted both are seen, but from clinical relevance, what is more important? Bradypnea is more important. No, I have told you consistently, low respiratory rate is the most characteristic sign of opium poisoning. Low respiratory rate is the most characteristic sign of respiratory for the opioid poisoning. If you remember in the class, I say whenever you see respiratory rate very low, like less than 10, always think of opioid because the treatment is guided by the respiratory rate. If the respiratory rate is too low, patient may require ventilatory support. If the if the respiratory rate is too low, patient may require respiratory support. So the answer becomes bradypnea. Pupil constricted option में नहीं था, meiosis नहीं था. अच्छा, so what was the answer? What was the question? Unequal pupil size. Unequal. So even unequal pupil size is very non-specific. Unequal pupil size is very non-specific choice. Okay, different size of pupil size is also very. Respiratory depression is, or bradypnea or respiratory depression, whatever it was, that is the most characteristic of opium poisoning. Okay, somebody is saying that in there were two choices with quad hank. Can you tell me what were the two choices with quad hank? What were the two choices with quad hank? Anyone? There were two choices with quad hank. अरे जवाब तो दो ना, जय गुरुदेव तो ठीक है, पता नहीं. ठीक है, इसमें if the person there is an accused of sodomy, so what will you take to confirm sodomy? How will the sodomy be confirmed? Simple thing, quad doctrine. So please remember the answer is quad hank. There was something quad doctrine. I don't know what is quad doctrine. I have no idea. But the answer will be quad hank. Answer will become quad hank. So that is a simple PYQ. Okay. So this is also PYQ. So forensic is all PYQ. So here, how will they only one test to one confirmatory test for sodomy? See, there are many signs of sodomy, like lateral traction test is positive, loss of perianal fold, all those things. But those are not confirmatory. What is confirmatory? Confirmatory is only one thing, when you can detect the semen near anus. That is the only confirmatory thing. All other things will be suggestive. They will not be confirmatory. So how will you get the semen? By rectal swab, rectal or anal swab, whatever it was. I don't know if the choices are correct or not. Are the choices fine? Choices are fine or not? Tell me. Choices are fine or not? Okay, so in that case, the answer will become rectal swab. Clear? Now, shoulder joint x-ray. Now, this is a bit controversial because I could not get the image. But I will tell you one thing. What you could have seen? What you could have seen, that I will let you know. So here, one is, what do you see in shoulder joint? You see humerus. You see acromion process and coracoid process of which bone? Scapula. And you see outer end of clavicle. Outer end of clavicle. These things you can see in the shoulder joint. So outer end of clavicle will not help us, give us any information. It is the inner end of clavicle which helps, not the outer end. So outer end of clavicle will not help. In humerus, there is head, greater tubercle and lesser tubercle, which appears at 1 ear, 3 years and 5 years, and they fuse with the shaft at 17 to 19 years. Most likely these three centers were present. What I could understand from the people is that head in the humerus, if we talk about the humerus, the head, greater trochanter and lesser trochanter were present but not fused. Not fused. So not fused means the age is less than 19 years. Age is less than 19 years. Then the very important will become acromion process and coracoid process. So here you have to remember that acromion, most likely the acromion process and coracoid process. Please remember, acromion process appears and fusion 15, 18, 11, 16. So acromion process appears at 15 years and fuses at 18 years, fuses at 18 years. The coracoid process appears at 11 years and fuses at 16 years. So, what I could understand from students is acromion process was not fused, but coracoid was fused. Coracoid was fused. Okay, something like this was there. Acromion was not fused, but coracoid was fused. So this is what I could understand. Okay, so in that case, the if this is the right, if this is was this it was, then the answer will become 16 to 18 years. So this is a bit tricky. Why it's a bit tricky? Because normally shoulder joint is not very commonly asked for. So though it is a previous year topic, but I will call it bit moderate to difficult level, because shoulder joint, though it is a part of PYT, but it is not commonly shown as an image. Normally we show the image of elbow joint or X-ray or wrist joint. Okay. So 16 to 18 looks like the age. सर इन लास्ट क्वेश्चन सीमन भी था ऑप्शन में. अब ये तो फिर एग्जैक्ट क्वेश्चन चॉइसेस बताना पड़ेगा. फोर्थ ऑप्शन वाज सीमन टाइप. I don't know. Semen type, because in rectal swab also we are going to check the semen only. So in that case, आधे से ज्यादा क्लेवल देख रहे थे सर एक्सरे में. क्लेवाइकल हैज नो रोल. प्लीज रिमेंबर, क्लेवाइकल in shoulder joint you will see the outer end of clavicle. That does not give any information. Clavicle inner end gives us the information, but that you could not see in the shoulder joint x-ray. Okay, so it was mainly the game of acromion. So that's the reason I am saying it is a bit difficult question. बस हो गया. Any other question you remember? देखो forensic तो you all are भेड़ियाज. Almost I discussed 8 questions and all of them were PYT. Anything, any other question you remember? कोई और question याद है? Okay, so if there is no other question, rectal swab with epithelial cell था कुछ नहीं. अगर सीमन चॉइस में था तो फिर सीमन मार्क आंसर हो जाएगा. इफ सीमन वॉज देयर इन द चॉइस, देन द आंसर विल बिकम सीमन. वन ऑप्शन रेक्टल स्वैब विद सीमन एंड एपिथेलियल सेल्स. देखो अगर कहीं पे सीमन था तो सीमन बिकम्स द कंफर्मेटरी. अगर सीमन वॉज देयर तो सीमन विल डेफिनेटली बी द आंसर. दैट विल बी 100% कंफर्मेटरी. तो दिस वॉज अ कॉमन सेंस क्वेश्चन. बेसिकली दिस इज अ वेरी कॉमन सेंस क्वेश्चन. ठीक है, तो सीमन अगर है तो सीमन तो ही, सीमन से ही तो पता चलेगा ना सोडोमी हुई है. सीमन अगर मिल गया तो सोडोमी हुई है, नहीं तो सीमन कहां से आ जाएगा एनस के पास. कमाल करते हो. हाउ विल सीमन कम इफ देयर हैज नॉट बीन सोडोमी? ओके, सो थैंक्स ऑल एंड नाउ आई विल वेलकम डॉक्टर अमृत नाश्ता सर to take the surgery class. Welcome sir.
थैंक यू सो मच अतुल सर. आपके इतने में ही मुझे कितना सारा सीखने मिल गया.
नहीं सर, क्या मजाक करते हो. थैंक्स सर.
Okay guys, how did the paper go? So I got quite a lot of questions and some are a little incomplete, don't mind that, but quite a lot are quite legitimate. Okay, and if any of these were discussed before, then you can let me know. I'll skim through them. And second thing is, I always say general surgery is far more scoring. This paper had so much general surgery. I hope you would have studied it from me or an anatomy or an ENT and you would have gotten the questions right. Okay. There were some tricky questions, but those are not our target. Our target is the basic standard normal questions. Tough questions थोड़े होते ही हैं, but that's okay, right? We don't need to get all questions right. We need to get the straight normal questions right. So let's see. थोड़े tough थे, not gonna lie, but the easy ones वो तो आने चाहिए. Right. So mother went to a pediatric surgeon. Child had a groin swelling, and when the child would cry or urinate, basically strain, the swelling went down medially. What is the likely cause? And I'll just give you a disclaimer. These are not exact questions. They were big clinical STEM questions, so they would have troubled you. I have just gotten the crux of the question. Okay, so don't say this is not the exact question, because I'm only telling you this is not the exact question. None of these are exact. I'm just going to give you what I got in the recall, the crux of the question, so you understand the topic. So if a child, 1 or 2 year old, has a hernia, it will be an indirect hernia. Option B here is the correct answer, patent process vaginalis. Okay. Direct hernia is seen in senior people. Male or female or doesn't matter, answer will be indirect in male only. That is a congenital hernia. This is their favorite topic. They ask this day after day, night after night, exam after exam. So patient had a breast cancer. 4.5 centimeters means it is T2. Okay. 4.5 centimeters means it's T2. Mobile lymph node means it is N1. So they didn't ask you what is T2 N1. They asked you the stage. So this is something you had to know. Stage 3 is locally advanced. Stage 2 is early cancer. So if it is T2 N1, which you see in this table, it will be 2B. So your answer is stage 2B. ठीक है? बहुत घिसा पिटा question है. This was one of the tricky questions. I mean, this is the kind of question they ask in ICDS. So if this question you made a mistake in, you should not feel bad. It's okay. If you use some common sense, which I have taught you in class, maybe you would have gotten it right. But this was one of the tricky questions. In fact, students could not understand what the question was saying. There was a long stem. Patient had a breast lump. It was removed. It was a lot of DCIS findings were given. And there was this word, 2 millimeter margin. This was given. This was one of the important points. Margin is 2 millimeters. What is the next step? Now, there is a way to calculate what you have to do next. But 2 millimeter means it is close margin, means some cancer cells may be left behind. It's possible. If cancer cells are left behind, what will you do? Give radiotherapy. So best answer here is radiotherapy. Don't say BCT. BCT is not done in DCIS because in BCT you have to do lymph node biopsy. In DCIS there is no lymph node biopsy. Mastectomy could be the answer, but from the available information, radiotherapy is the best answer because some cancer cells may be left behind. Easy question. They are given an image. Patient had dilated veins in the leg. Now either it is C1 or C2. From my understanding, students are saying they were very small. They were not varicose. They were reticular varices or spider veins. They were like spider nevi. So if it is spider nevi, it will be C1. Okay, chemo भी नहीं आएगा. DCIS में chemo भी नहीं देते because there is no metastasis. There is no lymphadenectomy, correct? So it's either radiotherapy or mastectomy, but in my opinion, radiotherapy would be the expected answer. So more than 2 millimeter ही होगा ना? That means maybe little bit margin may be left behind, maybe. So here the answer would be C1. Was there a question on which vein is dilated? Anatomy question. ऐसी कोई question थी where which vein is dilated? Let me know in the comments, I will see. Okay. The reticular varices should not have swelling. If it's reticular veins, it is C1. Then this was easy question. They had given an image of a skin graft on the leg, which was meshed, right? It was meshed graft. So obviously there the answer is going to be split thickness. This lot of students confirmed. So there was a question on great saphenous vein. Okay. Okay, that I think is anatomy, but okay. We have covered it in our class. So this was split thickness. I don't know what the other options were. Students were like, 2 options were irrelevant. So I was like, very good. Again, I'm saying question had a big clinical stem, a lot of the questions, but I have made it short because that is as much as recall as I have gotten. I know exact questions were much bigger, so don't mind that. This was one of the nice, tricky question where they tested your understanding. Big clinical stem, burns patient, inhalational burns, soot over face, nasal hair was singed, carbon monoxide was high, oxygen saturation was low. Lot of things were given and they had asked what is the next step. Obviously in burns, how we resuscitate A, B, C, D, E. So first airway, then breathing, then circulation, correct? So a lot of people felt answer should be A because he is having low saturation. But understand in inhalational burns, person is at risk of laryngeal edema, which manifests later. So the best answer here would be intubate. Okay, that would be the best answer. If there is hyperbaric oxygen, that is also fair. Okay, that is also not entirely wrong. But in my opinion, best answer would be intubation because he is at risk of laryngeal edema. One option was IV B12. Okay. Patient alert and tachypneic. Okay, more the reason to intubate. Okay, more the reason to intubate. Burn in neck, everything tells me there are inhalational ones. The history was suggestive of inhalational ones. This was normal. We have covered this in our chest trauma. So person has a stab in the neck and they had given the zone, and with common sense, you would have answered this question that there is air bubbling, means it's a tracheal injury. So what will you do in tracheal injury and what is the zone of the injury? This is zone 2. Zone 2 is the most common zone. And if there is tracheal injury, you are going to explore. So answer here will be zone 2 and exploration. Yeah. Deep burns neck and face, more the reason to intubate. It is only telling you that there is a airway injury because all those burns will cause problems. There is an inhalational injury. Okay, so your answer will be zone 2 explore. This is controversial. I don't know if Vivek sir discussed this. So if he's discussed, please let me know. And I'll tell you, I've taught this in class. I've even shared the table of degloving injury comes in what, but there are two schools of thought. So you have to choose what the question was actually asking. There was a lower limb wound, looked like a degloving wound, but students told me muscle was also cut. And what is the category of triage? See, degloving by itself is yellow. Okay, degloving by itself is yellow category. But if it is bleeding, obviously it becomes red. Goes without saying, you have to stop the bleeding. You can't put him in yellow and look at him after 1 hour. So if there is bleeding, answer is red. Goes without saying. Okay? Skin was off, muscle was hanging, bleeding. Yeah. So video, it was not a video, na? The video question, blood is coming. But yeah, if bleeding is there, automatically it becomes red. This I'm sure must be covered in anatomy. Constriction 40 centimeters is diaphragmatic crura. So this we can skip. Easy question. There was a neonate with a very big cystic hygroma and they had asked for treatment. So treatment of cystic hygroma is to remove it. Students were like immediate or operate at 1 year. What do you think should be the answer? Will you operate immediately or operate at 1 year? By simple logic. The child is born. He has a big cystic hygroma on the neck. So what should you do? Yeah. And if there is any other option or anything more in the question, then you can tell me. So obviously, if the child is born with a big cystic hygroma, you will operate immediately because it can compress his airway. Maybe it caused difficulty in delivery also. We don't know that, but immediate operation would be my answer. Operate at 4 year. Okay. Why would they even put that? Operate at 4th year. Means they are just, playing with you. Okay. Aspirate or excise. Excision is the answer, but if there is a choice of immediate operation or excision, that is the best answer. This is a PYQ. This has been asked 3-4 times. It's there in all our ENDs, you will see. So there was a child with a cyst, outer canthus of the eye. That is a congenital dermoid cyst. Okay. Earlier they have asked. This is also a PYQ repeat. There was a swelling in the floor of the mouth. They had asked a diagnosis. I think it is ranula. Okay. This, I've gotten different versions of the question from different people. Okay. Different versions from different people. I'll tell you what is my thinking. This was also a clinical STEM question. That they gave a lot of history and then they had given an X-ray or an ultrasound of submandibular gland stones. Right? So there was submandibular gland stones and they had asked the treatment. Now, in principle, the treatment is removing the stones. You don't have to remove the gland. One option involved parotidectomy. One option was removing submandibular gland fully. One was partial. So submandibular gland fully is not necessary. Okay, that should not be the answer. Option A would be the best answer, and how to remove it depends on the size of the stone. Okay, the technique of removal is dependent on the size of the stone. Superficial submandibulectomy, yeah, we don't need to do it. With inflammation of gland, that is because of the stone. So this is little controversial, but in my opinion, answer should be remove the stone, the inflammation, everything should subside. Okay, this you have to tell me what the exact wordings were because the answers can change completely. Okay, the answer can change completely. So they had used these words, thyroid neoplasm. And question was asking how to look at extrathyroid spread. Was it extrathyroid spread or was it metastasis? Because if it is distant metastasis, then you will do iodine scan, whole body radioactive iodine after 3 to 6 weeks. If it is extrathyroid spread, then it should be MRI. Okay, stone size 1.4 centimeter, then you have to do open surgery to remove it. Okay. That answer I'll confirm with ENT, sir. Okay, the stone wall answer. So if here the question is extrathyroid spread, answer is MRI. Means you want to see how much it is going around the thyroid. Iodine scan would be for metastasis. Okay. This confirmed this question. There was a big clinical scenario. It was suggestive of tension pneumothorax, and they had given a chest X-ray also where you could see collapsed lung and black lung fields, chest fields. And they had asked what is the next step. So best answer is needle decompression. They didn't give triangle of safety, so second intercostal space is the next best answer. Okay, because this is new guideline, but they didn't give space to not confuse you. So option A would be the best answer. I don't know what the other options were. Students were like, in dono mein we had to think. Okay, we had to think in between these two only. So answer here is second intercostal space. Easy question. Post, they're given there is a D1 ulcer on the posterior wall which is bleeding. What artery is affected? Gastroduodenal artery. So that is an easy one. Then there was a clinical scenario. They had given the triad of Boerhaave syndrome, chest pain, subcutaneous emphysema, and everything. And they had asked, how do you diagnose it? It is CT. CT with oral contrast, not endoscopy. Endoscopy is for corrosive injury. Here it is CT with oral contrast. Another easy question, after thyroid surgery, woman is not able to sing in a temple. What nerve is injured? This is going to be superior laryngeal nerve, where you are not able to raise the pitch of your voice. Recurrent laryngeal nerve will cause hoarseness. This question, lot of students could not properly understand. So whatever information I got and what I believe, I will tell you. Big clinical question. Elderly male, malnourished, steatorrhea. You thought it could be a malignancy. They had given a CT